So we're going to start with the pectoral girdle. The pectoral muscles obviously are up here, and this girdle, as they call it, is attached to that region and helps give your arms movement and stability. We're going to start with the clavicles. The clavicles, also known as the collarbones, are right here, and there's two ends. At one end, they attach to the sternum. So they actually call it the sternal end of the clavicle. That's the more medial side. And then on the other end is the acromial end. And it's called that because of a part on the scapula, which we'll get to in a sec. So you do have two separate clavicles or collarbones. And that's part of the stability of not just the upper arm bones, but also of the upper chest. As you can see, it connects directly to the sternum, which connects to the rib cage. The scapulae, that is a plural term. Each one is a scapula, also known as the shoulder blades. So this is a frontal view or anterior view, as if we're looking through this person's chest. So from the back, the shoulder blades are more obvious. Some people can stick them out pretty far. They have a lot to do with connecting of back muscles associated with movement of the shoulder. The scapula is interesting because most of it is this giant blade-looking thing that they call the body of the scapula. But these little projections up here that connect with the clavicles are very important. This right here is actually called the acromion, and it's right here as well. You can barely feel it. If you find where your clavicles end, this bump right here is the acromion. Some people call it the acromion process. And that's why they call this end and this end of the clavicle the acromial end. So that is pretty much the pectoral girdle. The other thing I wanted to mention is that in the next set of lessons on joints, we're going to talk about ball and socket joints. The classic ball and socket is how the femur connects to the pelvic area. But you could claim that this is a ball and socket joint. It's same basic type of movement, but it's not a hollowed out bony section that's fitting the head of the humerus, the upper arm bone. It's actually a rotator cuff, and most of you have heard that term before. The rotator cuff is not bony. It's actually a lot of connective tissue, ligaments, tendons, and muscle fibers associated with fitting in that part of your arm. Now, to the upper appendages, the arms. If we start with the most proximal, closer to the torso bone, that would be the humerus. The way that I remember that this is the humerus is people refer to hitting this part of your body as hitting your funny bone. And humerus, like humerus, spelled differently, but you can help yourself remember that this is the humerus bone from that little trick. By the way, the funny bone is actually not referring to a bone. Unlike your kneecap, which is a separate bone in your leg, there's no free-floating elbow bone. The elbow point is actually a part of the ulna, which we'll get to in a sec. But when you hit what's called your funny bone, it's when your arm is in a certain position, and when you hit it just right, there's a nerve that's not too deep under the surface of the skin, and if you hit it, you're going to get that stinging feeling that we've all felt before when we hit that funny bone. This would be the head of the humerus, which does fit into the rotator cuff, which we just mentioned before. And then down here, there are some notches that fit in the radius and ulna, the two forearm bones. Speaking of which, the radius and ulna make up that part of the arm. The way that I keep it straight is the ulna, U, starts with the U, is on the pinky side. P-U. P-U. I know it sounds kind of random, but I just think of P-U, which is what people say when they smell something funny, for remembering that the ulna is on the pinky side. The radius is on the thumb side. And you can see from this image, when this individual rotates the thumb medially, towards the middle of the body, you can see that the radius kind of crosses over the ulna and stays with the thumb. On the right-hand side of this picture, you can see that when the thumb is facing towards the outside end of the body, that it stays with the thumb, and the ulna is on the pinky side. The carpals, that is the general term for wrist bones. You could see from this diagram, they label this one bone in the wrist as a carpus. That's a general term you could use to describe each individual bone. But in general, you can call all of these carpals. And later on in the joints chapter, we'll get into carpal tunnel syndrome and why that exists. There are plenty of wrist bones and finger bones, and the amazing thing is, if you add up all the wrist bones and the bones of the palm and the fingers, and you add up all your ankle bones and the bones of the feet, the total number is actually more than 50% of all the bones in your body, amazingly. There are about 206 bones in the average human body. All the wrist, ankle, hand, and foot bones, 106. That's an interesting little fact. The metacarpals would be the palm bones. If you've ever seen a skeleton, just plain skeleton, looks like, wow, the fingers are really long. Well, the metacarpal bones, you normally don't see very well in a person's hand. So the metacarpus, they're labeling just one of them. But the metacarpals are those palm bones. And then finally, the phalanges. That's a general term for finger bones. And actually the same term applies to the bones of the toes. You can actually name each of these phalanges something more specific, and I'll give you the hint there. Thumb is 1, pointer finger is 2, middle finger is 3, ring finger is 4, and the pinky is 5. And you can use those relative position terms we went over before, distal, proximal, to help name them. Now, if you look at the thumb, there's only 2 phalanges. 1, 2. It's shorter than the other ones. You know, all the other fingers have 1, 2, 3. The one that is closest to the trunk of the body, you can call that proximal phalanx 1. And the word phalanx means 1. You don't say phalange. Phalange is not a real word, but phalanx is the singular word. So proximal phalanx 1, and you can guess that this one is distal phalanx 1, number 1, because that is the first digit. And then so on and so forth. Now there is a middle phalanx in all of these, so it's as simple as that. This would be distal phalanx 2, middle phalanx 2, proximal phalanx 2, all the way to number 5. Distal phalanx 5, middle phalanx 5, and proximal phalanx 5. Now moving on to the pelvic girdle. Pelvic girdle, also called the pelvis, is actually made up of a bunch of bones fused together. And we can call the pelvis the coxae, C-O-X-A-E, or coxal bones. And there's 3 main segments. The ilium is the classic part that we think of when we imagine the pelvis. The ischium is right down here, and the pubis is, of course, in the pubic region. And we'll get into the pubic arch and the ramifications associated with that in a sec. The part that is most easy to feel on the pelvis is the iliac crest. So since this is the ilium, and there's a corresponding ilium on the other side, right here is known as the iliac crest. And there's one on each side, of course. Now, when it comes to the pubis, each coxa, made of an ilium, an ischium, and a pubis, is connected via what's labeled here, number 8. It's a cartilaginous pad, and here they call it the interpubic fibrocartilage. Similar to the pads you would see between the vertebrae of the spine, you have a joint there that's not highly movable, and it's meant to connect those 2 coxae at that pubic region. Now, when you look at male and female pelvises, the general difference is that when you look at this angle right here between each pubis, if it's 90 degrees or less, it tends to be a male pelvis. If it's 100 degrees as an angle or wider, it tends to be a female pelvis. Now, there are exceptions. I'm speaking in generalities now, but in general, female pelvises appear wider, and that corresponds to, you know, hips that are a bit wider on the average female compared to men. And of course, when it comes to giving birth, that wideness helps accommodate the baby coming out. And finally, the lower appendages, or the legs. The femur is the largest bone in the body. So femur, right here in orange. The head of the femur fits in very nicely with what's called the acetabulum of the coxae. On the previous slide, if you look back, there is a slightly hollow region that's on the lower side, inferior lateral portion of each of these sides of the pelvis, and it's a nice socket to the ball, the head of the femur. Of course, down at the lower end, it connects to the knee section, and you can see that the femurs have this angle that's kind of coming inwards, coming in more medially as you go from top to bottom. If you look at the angles that other primates' legs connect to the pelvis, not quite the same. And this has to do with our locomotion and a little bit with our posture. If you compare the legs of a chimpanzee to a human, very different in terms of the angle in which they connect to the pelvis and come down in the leg. The patella, which we'll use green for, is right here, the kneecap. And in the joints chapter, we'll talk more about the ligaments associated with connecting the patella to the tibia and connecting the patella to the muscles within the quadriceps, the thigh muscles. The tibia is the major shin bone right here. So when you feel that sharp point in the middle of your shin, that's right up front in the anterior portion of that, you're feeling the tibia. On the side, if you look laterally, you've got the fibula. And if you kind of press in on the side of your calf, you can feel the fibula. Now, the way that I keep these terms straight is a nickname for a little lie is a fib. And so I think fib, little lie, fibula, smaller or more little of the two shin bones. So tibia, the big one, fibula, the smaller one, that's just lateral to it. And then you've got, corresponding to the wrist and hands, instead of carpals, we call them tarsals here. So the tarsals, all of these bones in here. The back one, the one I want to highlight, the heel, is also known as the calcaneus on the back. And that will come up again because of the calcaneal tendon, also known as the Achilles tendon. So that Achilles tendon connects to that heel bone, and that is the calcaneus is the largest of those tarsals. The metatarsals correspond to the palm of the hand. So the metatarsals would be those bones that are inside the foot that you can feel but can't see as easily. So all of these bones here, these would be those metatarsals. And finally, the phalanges. The phalanges would be all of these bones in here. And you have the same naming system as when we looked at the fingers. When you look at, let's say the middle toe, for instance, you would have the distal the distal third phalanx, the middle third phalanx, and the proximal third phalanx, and so on. So that's the legs, and that finishes up the appendicular skeleton.